In the later part of the video, I am going to explain how to utilize the rapid revision videos or notes that you follow instead of the BTR and still clear this exam with good marks, and also I am going to show my own BTR to make you understand better. Let's start the video. So first you need to have a BTR, so take a printout of it and then start watching the class. If you have cerebellum then good, if not then take subscription. In my previous video someone commented that there is a plan of BTR for 11,000 and I didn't see it before, so you can purchase that plan, or else find a friend who can give you app and then start watching the videos. I did the same by taking the app from my friend and used it before the exam, and while watching the videos see the notes and add any points that are missed in the notes, and if there are any errors in the notes you should correct them. And once the video is finished, for example you watched surgery, then what you will do is you will solve the surgery previous year questions. And from where you are going to solve the questions, I already told you, right, that if you are using any app then use it like Marrow, PrepLadder and Cerebellum to solve the previous year questions. But if you are not subscribed to any app, then you can go to either Mist, Dams or PrepLadder YouTube channels, and there you can see the previous year questions with explanation. So solve them, and now I am going to tell you the right way to solve previous year questions. We are going to see previous year questions of January 20, 2024 paper. For example, look at this question. It was asked, shock waves of air blast will affect which part of the body? Here you can see there are primary and secondary injury. Blast injury comes under the primary. In that, tympanic membrane is the most commonly injured and second is lungs. But in the options you don't see tympanic membrane, so you will go with the lungs. Next question. A patient presented in the OPD complaining that on walking a certain distance he feels pain in his calf region, because of which he cannot walk any further and has to take rest. As per Boyd's grading, it is classified as which of the following grades? Answer is 3. You can see this in the aortic occlusion topic in BTR. Grade 3 is compelled to take rest. Now this one. A patient was admitted in the hospital for a long period of time, following which she developed pain and swelling in her leg. Which of the following should be the investigation of choice to conclude the given pathology? Duplex imaging. So this topic was there in the BTR, but in surgery section I didn't find the investigation of choice. So while doing MCQ, PYQ or GT, I added this point and it came in the exam. Like this you should add points that are missing in the notes and make your BTR as whole. Like this many questions came. Now I can't put everything here because after exam I didn't study from BTR again. So after seeing question I know that it is from BTR, but don't know from where to take screenshot. So I just searched a few random questions and showing for you. So now you understand, right, that you have to see videos, then read the BTR notes once and solve the PYQ of that subject, and then keep solving 100 MCQ daily from FMGE solutions and add necessary points to the BTR. Whoever don't have the FMGE solutions 8th edition hard copy, download it from my Telegram group. I uploaded it there. And while solving MCQ itself, give 4 to 5 GTs by the end of the exam. The notes that you prepared by adding content from MCQ, PYQ, GT will be very high yield, that in the final 7 to 10 days, except BTR, you will not solve any GT, any questions, and you don't need to watch any video. You might be thinking how to remember the whole notes and how to do effective revisions. What you have to do is active recall. We have to study the same way we used to do during childhood, covering the question with hand or making a flashcard by forming a question and recalling it. You can use Anki also. This actually helped me because photographic memory plays a lot of role. That is, revising the notes again and again or doing active recall will form an image memory of that page. I will tell how. In the recent FMGE exam, after giving first paper, I thought that I will fail or maybe I am in border because I didn't give too much importance to the preclinical subjects. I only focused on paraclinical and clinical. In that also I didn't do medicine. I will talk about this in the next video because you don't need to study all 19 subjects. Do watch that video because I will tell you which subjects to focus more, and I did the same. So after writing first paper, I came outside and sit at some place, thought about which subjects didn't come in paper 1. Then I started revising surgery, and then while reading the notes, I read this. And then I recalled it so many times before going to the exam, and to my surprise this question is in the exam. They asked which is the least radio sensitive, and S is there in the option, and I answered it. This is an example that everything is not covered in the BTR, but you have to add few information from the MCQ, PYQ that you solve to the BTR so that it becomes complete. Okay. Now coming to the people who can't subscribe now to the BTR. See, the topics that I am showing in BTR are present in every rapid revision and coaching notes, but no one study and also no one revise. So use the same methods. If you already finished watching main videos and notes is ready, then concise them and make it short. But if you are using rapid revision or want to follow rapid revision now, then first finish rapid revision videos and then solve that subject previous year questions, and any extra point that you find is important, add it to the rapid revision notes and keep solving questions and do GTs, and you are done. Don't listen to fake talks and fake motivation or too much hyped timetables. Just follow the plan and you will clear the exam without any doubt. I think approximately 60 hours of BTR videos are there. Even if you watch 4 hours of video and solve the previous year questions of that subject, you can finish BTR along with previous year questions in just 15 days and you are done. You don't need to see bonus BTR also now. Just focus on BTR, that's enough. After these 15 days, start solving questions from FMGE solutions and write down the extra points in the BTR, and also do at least 4 to 5 GTs. That is more than enough. You can see topics are same in the GT and BTR or MCQs, but you should pay a little bit more attention while solving questions. So that's it for today's video. In the next video, I will talk about which subjects are needed to clear FMGE and sources you can use. So make sure you watch it. In the end, I want to say only one thing. Whether it is marrow, prep ladder, cerebellum or doc tutorials or PW method, missed dams. Every coaching is same. Some people from every coaching cleared FMGE. So it is not like this coaching is good and that is bad. Similarly, I cleared using BTR. As I cleared this exam, now I am explaining you how you can do it. Now it's in your hands how you are going to utilize it. Until next video, signing off. Bye.